Daily prescription blood thinners are among the most commonly prescribed medications in the world today, especially for people over the age of 65. They are medical lifesavers. But 7 common garden herbs, some of them sitting quietly in standard everyday herbal tea blends, have documented clinical interactions with these medications. Interactions that can silently push a person's blood levels completely outside the safe therapeutic range. This information does not appear on seed packets. It does not appear in most gardening books. It certainly does not appear in most online herbal content. If you or someone you love takes a daily blood thinner, this is the video to watch first. Number 2 on our list sent a woman's blood levels to over 3 times the danger threshold simply from drinking a cup of wellness tea. Number 3 has been on medical warning lists for decades, but the modern research only convicts half of it, and the innocent half is probably the one growing in your backyard right now. And number 5 currently has clinical researchers actively arguing with each other about which direction it even pushes your blood levels. This is not a video about giving up your garden. Every single herb we are covering today is completely safe, legal, and has been grown by families for generations. This is simply a masterclass in what happens when these potent natural plants meet a class of medication that has almost zero margin for error. Here's why. Standard blood thinners, like warfarin, work by blocking the body's ability to use vitamin K to manufacture crucial clotting factors. Less clotting factor means thinner blood, and that is exactly the medical point. It prevents strokes, prevents clots and atrial fibrillation, and prevents deadly clots from forming around mechanical heart valves. But most modern drugs have a wide forgiving margin between an effective dose and a harmful one. These medications do not. Too little, and a stroke can form with absolutely no warning. Too much, and you face severe bleeding risks, sometimes internally, sometimes directly into the brain. That's why people on these regimens get regular strict blood tests called an INR test. The target range is incredibly tight, typically between 2 and 3. Below it, your clotting risk rises. Above it, your bleeding risk explodes. Here's exactly why your garden matters. These medications are broken down in your body by a specific liver enzyme known as CYP2C9. Anything you ingest that speeds this enzyme up or slows it down completely changes how much medication remains in your blood without you ever changing your daily pill dose. Furthermore, because the drug's entire effect depends heavily on vitamin K, anything that alters how much vitamin K reaches your bloodstream completely rewrites how the drug works again, without you ever touching your prescription bottle. 7 herbs, 3 distinct biological mechanisms. Nothing in this video is medical advice, but I am going to flag exactly where your doctor or your pharmacist needs to be brought into this exact conversation. Herb number 1 is St. John's wort. This plant grows completely wild across temperate climates, but it is also planted deliberately in backyard gardens. With its small, bright yellow flowers, it is frequently sold in seed packets as a beautiful perennial for borders and wildflower mixes. At the same time, it is one of the most widely sold herbal supplements on the planet, taken by millions of people for mild mood support and available over-the-counter without a prescription anywhere. That exact dual life as an innocent garden plant and an accessible supplement is precisely why it tops our list today. A homeowner could easily be growing it for the aesthetics, taking it as a capsule or both, without ever connecting either habit to their cardiovascular prescription. Here is the exact biological mechanism. St. John's wort acts as a powerful enzyme inducer. It drastically speeds up the specific liver enzymes responsible for breaking down blood thinners like warfarin, mainly an enzyme called CYP3A4, but also CYP2C9, the precise one that matters most for keeping your levels stable. When you speed up these enzymes, your liver clears the medication out of your system much faster than intended. Faster clearance means less of the drug remains in your bloodstream, and less medication in your blood means you lose your critical protection against deadly blood clotting. This is not a theoretical concept. A landmark study published in the British Journal of Clinical Pharmacology administered St. John's wort to volunteers and meticulously measured what happened to the medication in their systems. The results were stark. The rate of drug clearance increased significantly. Furthermore, medical literature contains numerous documented cases of actual patients who were completely stable on their blood-thinning regimens for years, whose protective levels suddenly plummeted right after they started taking St. John's wort. Their bodies only returned to a safe target range after they completely stopped the herb, or after their doctors drastically increased their prescription dosage to compensate. Because of this undeniable data, the standard guidance across global drug interaction databases is absolute and direct. If you are taking this class of medication, you must completely avoid St. John's wort. Of all 7 herbs we are covering in this video, this is the only one where the medical answer is this clean and unforgiving. The data does not say monitor your levels. It does not say use caution. It says avoid. However, one massive nuance matters here. If you are watching this right now and you realize you are already taking both, do not stop taking your St. John's wort on your own today. Because your body is currently processing the herb, your doctor may have already unknowingly adjusted your prescription dose higher to compensate for it. If you stop the herb suddenly, your liver enzymes will slow back down, causing your blood thinner levels to spike sharply in the opposite direction. This instantly pushes you toward over-anticoagulation and a catastrophic bleeding risk. Bring this exact video or a list of your supplements to your doctor and let them transition your dosage safely. Herb number 2 is ginger. Imagine a 76-year-old woman. She had been medically stable on her blood-thinning regimen for years with absolutely no complications. Then, she started drinking a daily cup of ginger tea as a natural wellness remedy. A few weeks later, she developed a sudden, severe nosebleed. When emergency doctors checked her blood, they discovered something alarming. Her INR, the exact number that measures how thin her blood is, had climbed to over 10. Remember, the safe therapeutic target range is strictly between 2 and 3. An INR over 10 meant her blood was so thin it was barely capable of clotting at all. Hospital staff immediately stopped her ginger intake and administered vitamin K to force her blood chemistry back to normal. It worked, and her levels successfully returned to a safe range. This was a real, documented case published in a peer-reviewed medical journal back in 2004. And it isn't an isolated data point. Separately, A much larger clinical study followed 171 patients on blood-thinning therapies over several months. The researchers discovered that the individuals who regularly consumed ginger were statistically far more likely to report bleeding complications than the patients who didn't touch it. So, why does a common kitchen root do this? The biological mechanism comes down to your platelets, the cells responsible for rushing to the scene of an injury to clump together and stop a bleed. Components in ginger can actually make these platelets less sticky, reducing their ability to form a clot. Because medications like warfarin already reduce clotting through a completely different chemical pathway, combining the two creates a compound effect. The two mechanisms add up, leaving your body dangerously unprotected. But here is the honest complication that most health creators leave out. Other clinical trials have given healthy human volunteers a precisely measured dose of ginger alongside their medication, monitoring their blood metrics with extreme care. The result? Absolutely no effect, none at all. So, which data set is telling the truth? The answer is likely both. It completely depends on the volume consumed, the duration of use, and individual genetics. The woman in the emergency case report was consuming highly concentrated ginger every single day for weeks as a potent home remedy. The healthy volunteers in the clinical trial were given a single, controlled dose. Furthermore, every single human liver processes medication at a slightly different speed, which is the entire reason regular blood tests exist instead of doctors just prescribing a single uniform dose to everyone. Here is the ultimate bottom line. Regular, heavy ginger consumption can exponentially increase bleeding risks for certain individuals on blood thinners. It hasn't been shown to cause this emergency in every single person, and using a pinch of regular ginger in occasional dinner cooking is generally considered safe. However, if daily ginger tea, ginger shots, or concentrated supplements are a non-negotiable part of your wellness routine, you need to mention it to your doctor, even if absolutely nothing has gone wrong yet. Herb number 3 is garlic. It is found in almost every kitchen on the planet, and it sits near the top of almost every medical warning list. The clinical concern here is entirely real. Just like ginger, raw garlic contains active compounds that can make your blood platelets significantly less sticky. In the medical literature, there are several older reports detailing severe bleeding complications in patients who were taking garlic supplements alongside their daily blood thinners. One particularly shocking case report even described a patient who suffered serious, spontaneous internal bleeding without being on any prescription medication at all, simply from eating massive amounts of raw garlic cloves daily. Because of this, garlic earned a permanent scary spot on the official caution list. But here is where the modern research takes a highly unexpected turn. A rigorous clinical study took 52 patients who were already completely stable on their blood-thinning medication. The researchers split them into groups, giving half of them a high-dose garlic extract every single day for 12 weeks straight. But there was a catch. This wasn't raw garlic, nor was it a standard garlic oil pill. It was a very specific supplement known as aged garlic extract. Doctors meticulously monitored the patient's blood metrics throughout the entire 3-month trial. The final result? Absolutely zero increase in bleeding events or dangerous clotting changes. None. The researchers officially concluded that the unique aging process alters the plant's chemical profile, making aged garlic extract fundamentally different from raw garlic. They noted that the standard bleeding warnings simply did not apply to this specific version of the herb. So, let's look at the actual realistic picture. Raw garlic cloves and highly concentrated, unaged garlic supplements, especially the ones heavily marketed for heart health and blood pressure, are where the medical cautions legitimately apply. However, garlic cooked into your dinner the ordinary way, the way almost everyone uses it to season a meal, has never been shown to cause a single clinical problem with blood thinners in real-world studies. If you are growing garlic in your backyard for the kitchen and cooking with it normally, that is the innocent half of the research. It is not the part anyone needs to worry about. But if you are swallowing a concentrated garlic capsule daily for your cholesterol, or if you regularly eat raw cloves as a health trend, that is the exact habit you need to flag with your pharmacist. Herb number 4 is feverfew. Feverfew is a beautiful garden plant covered in small, white, daisy-like flowers, and it carries an incredibly long cultural history as a traditional remedy for severe migraine headaches. But this is the exact herb where we need to be most careful about the massive difference between what could happen in a laboratory versus what has actually happened to real human beings. When scientists study feverfew inside a lab Petri dish, they observe that it makes blood platelets significantly less likely to clump together. It reduces clotting similar to garlic and ginger, but it achieves this through its own unique chemical pathway. But here's the completely honest part that you won't hear on most sensationalized health channels. There are currently 0 documented real-world case reports of feverfew ever causing a single bleeding or clotting problem in an actual human being taking a blood thinner. None. Not one single case. Major clinical drug interaction databases state this directly. So why are we mentioning it in this video at all? Because that specific laboratory finding raises a very real logical question. If feverfew actively weakens your platelets and your prescription medication reduces clotting through a completely different biological pathway, combining the two could theoretically add up to a much higher bleeding risk than either one could cause alone. Emphasize the word theoretically. The honest verdict, using the exact phrasing of the clinical researchers who track these anomalies, is undetermined. It is not labeled as dangerous, nor is it labeled as entirely safe. It is simply undetermined, and that is a genuine scientific status, not a dodge. Because the medical community simply does not know for sure yet, several clinical guidebooks suggest exercising caution with feverfew if you are on a blood-thinning regimen. They don't do this because harm has been proven, but because waiting for the very first emergency case report to happen to you is a terrible way to find out. If you cultivate feverfew in your backyard and you take a daily blood thinner, remember that this is a proven lab finding with 0 human cases either way. That makes it completely different from St. John's wort, where all the clinical data points toward a clear danger. Consider this a low-priority warning, but it costs you absolutely nothing to casually mention it to your pharmacist during your next visit. Herb number 5 is peppermint. Whether it is in herbal tea, breath mints, or everyday cough drops, peppermint is absolutely everywhere. And unfortunately, so is the medical confusion surrounding it. Let's look at the first side of the debate. There are scattered medical case reports indicating that heavy consumption of peppermint tea or intensive use of menthol cough drops can interact with blood thinners, making the medication significantly weaker. When this happens, your blood fails to thin as much as it should, leaving you unprotected against blood clots. This side of the argument gained real scientific backing in a 2014 clinical study. Researchers administered concentrated menthol to test subjects and precisely measured how it impacted the medication in their bloodstream. The final result was clear. Menthol accelerated the speed at which the body cleared the drug by roughly 25%. A faster clearance rate means less medication remains active in your system. That data lined up perfectly with those initial human case reports. It seemed consistent. But then, the medical archives threw a massive wrench into the gears. When you look back at earlier documented medical history, you find a completely conflicting set of case reports. In those instances, patients who heavily consumed menthol cough drops experienced the exact opposite reaction. The peppermint compounds made their blood-thinning medication significantly stronger, drastically thinning their blood and creating an acute bleeding emergency. So here is the completely honest, unfiltered picture. The global research actively disagrees with itself regarding which direction this interaction even moves. The exact scientists who spearheaded that 2014 study stated plainly in their conclusion that far more human research is desperately needed. And here is the single perspective that I think matters most in this entire video. When scientific research cannot agree on which direction a biological interaction goes, that is not a reason to simply shrug it off or ignore it. It is a reason to pay incredibly close attention. An interaction with an unknown direction is an interaction that no medical label or warning box can protect you from properly. It introduces complete unpredictability into a treatment plan that requires absolute precision. If daily peppermint tea, strong mints, or especially medicated cough drops are a deeply ingrained habit for you while you're on a blood thinner, you must mention it to your healthcare team. Pay close attention to those cough drops during cold season. Almost nobody thinks of a throat lozenge as something they need to bring up to their doctor. But as the data shows, the chemistry inside your body says otherwise. Herb number 6 is parsley. It is the ultimate plate garnish that absolutely nobody thinks twice about. Up until this point, every single herb on our list has interacted with your body through liver enzymes or blood platelets. But parsley is completely different. This plant strikes directly at vitamin K, the exact chemical compound that medications like warfarin are explicitly designed to block. Let's look at the actual numbers. A single quarter cup of fresh raw parsley contains a staggering 246 micrograms of vitamin K. To put that into perspective, the average adult only needs between 90 and 120 micrograms for an entire day. That means a tiny quarter cup serving of parsley packs roughly twice your required daily intake of vitamin K, all concentrated into one single herb on one single dish, often consumed without anyone even noticing it is there. Clinical research on blood thinner interactions has repeatedly flagged 250 micrograms of vitamin K per day as the exact threshold where medication stability is threatened. A generous handful of fresh parsley gets you right to that danger line all by itself before you have even touched a single other item on your dinner plate. Here's why this matters for backyard growers specifically. Vitamin K doesn't make your medication toxic or dangerous in the way a standard drug interaction does. Instead, flooding your system with vitamin K makes the medication significantly less effective. This shifts your internal chemistry away from safety and directly toward a severe blood clotting risk. Both directions of this spectrum matter immensely, which is the exact reason regular blood tests exist. But here is the golden rule that almost never gets explained properly by health influencers. The underlying problem here isn't the parsley itself. Cardiologists and hematologists state this clearly again and again. You do not need to completely banish parsley, kale, spinach, or any green vegetables from your life. The real enemy is a sudden lack of consistency. Your daily medication doses are meticulously calibrated by your doctor around your normal baseline diet. If you eat roughly the same amount of green vegetables every single week, your prescription already accounts for it perfectly. The clinical danger only arrives during a sudden, drastic lifestyle change, like eating a massive bowl of parsley-heavy tabbouleh salad after months of barely touching greens, or suddenly cutting greens out entirely. And that exact unpredictability is precisely what a backyard garden creates. Parsley grows in massive natural flushes. Your garden might produce almost nothing for months, and then suddenly explode with more fresh herbs than you know what to do with. Deciding to heavily use up an entire garden harvest simply because it is sitting there is exactly the kind of sudden dietary spike that completely derails your regular blood test results without you or your doctor ever connecting the two events. Herb number 7 is basil. Biologically, basil operates through the exact same mechanism as parsley. It is completely packed with vitamin K. But basil behaves entirely differently in a backyard garden, and that behavioral difference introduces a unique medical trap. Fresh basil contains roughly 108 micrograms of vitamin K per cup, which makes it less concentrated than parsley by volume when fresh. But the moment you dry it, the entire chemical picture changes. One single tablespoon of dried basil actually packs more concentrated vitamin K than the exact same amount of dried parsley. But here is what makes basil a uniquely tricky plant for your health. Basil is a classic summer herb that explodes all at once. A single backyard plant can go from modest to completely overwhelming in less than 2 weeks. Because of this rapid growth, it is the one herb that almost every gardener turns into pesto, blending a massive batch all at once to be frozen and used over the coming months. From a vitamin K perspective, a jar of homemade pesto is a highly unpredictable variable. A person might use just a tiny spoonful a week for months, maintaining a steady, perfectly safe baseline. But then, they might use multiple heavy spoonfuls 3 nights in a row for a family dinner party, followed by absolutely nothing for the next month. The pesto inside the jar hasn't changed at all, but the volume consumed in any given week fluctuates wildly, and almost nobody tracks a casual condiment the way they would track a standard green vegetable. There is another hidden layer to this garden cycle. Basil bolts and goes to seed incredibly fast in hot summer weather. To save the crop, gardeners often harvest every single leaf on the plant simultaneously, compressing weeks of potential basil growth into a single jar of pesto in one afternoon. Because that harvest is compressed, It becomes almost impossible for a patient to accurately connect how much basil am I actually consuming this week to how much basil physically grew in my garden. The clinical guidance here is exactly the same as parsley, and for the exact same reason. This is not an issue of complete avoidance, it is an absolute issue of lifestyle consistency. Keep your weekly intake roughly steady. If you hit a summer week where homemade pesto suddenly shows up on absolutely everything you eat, that is the exact dietary spike you need to be consciously aware of. Here's the thing that doesn't appear on any seed packet, in any gardening book, or in most herbal content. The thing I promised at the start. These 7 herbs don't all do the same thing. A garden, almost by definition, has more than one of them. St. John's wort speeds up warfarin clearance, more clotting risk. Parsley and basil, same direction, through vitamin K instead. Ginger and feverfew push the other way, more bleeding risk. Garlic could go either way depending on the form. Peppermint, the research can't agree which way it goes. A garden with parsley, basil, garlic, and peppermint, most gardens, probably yours, isn't one interaction. It's several, different directions, different mechanisms changing with the seasons, and here's what people get wrong. It doesn't cancel out. An enzyme effect can take days to build and fade. A vitamin K effect from one meal can show up the next day. They're not on the same clock. A garden isn't one thing to check against a list. It's several things, changing all year, that nobody tracks as medication, because none of it looks like medicine. It looks like dinner. It looks like tea. It looks like a hobby. Interaction checkers are built for pill bottles, named supplement, fixed dose, every day. Not for a wall of basil in August, parsley and Tuesday sauce, peppermint tea most evenings, and a St. John's wort plant someone's been meaning to ask about, because the flowers are pretty. The single most useful thing you can do is tell whoever manages your INR what's actually growing in your garden and what you actually eat from it, not as a warning list, as context. The test works better when the person reading it knows what might be moving the number, and regardless of any herb, unusual bruising, bleeding that won't stop, blood where it shouldn't be, or on the other side, sudden swelling, pain, shortness of breath. Call your doctor. Those signs matter no matter what's growing in your garden. My grandmother's garden had parsley along the path, basil by the kitchen door, a feverfew plant nobody quite remembers planting, and a peppermint patch that had spread further than anyone intended, the way peppermint always does. None of that has changed. The herbs are the same herbs they've always been. What's changed is that more people than ever are managing a medication that depends on a delicate, narrow balance. And the gardening world and the medical world have never really talked to each other about it. A seed packet doesn't mention warfarin. A pharmacy leaflet doesn't mention pesto season. That's the gap this video exists to close. Not because your garden is dangerous, not because these herbs need to come out, but because if you or someone you love is on warfarin, the garden is part of the picture. And the picture works better when it's complete. 7 herbs, 3 mechanisms, 1 conversation worth having. I'm Elias Ford. This is The Honest Root. See you in the next one.